JuliAnne Murphy here, and it's an evening on a Tuesday. I'm after round 4 by about 5 days. And it's funny, I just said to my husband, "Don't interrupt me, I'm going to be doing a video." And his response was, "You don't look that good, baby." And I said, "That's the point." I'm doing this video because I want to be very realistic about the faces of cancer. One thing that I personally have been struggling with on this journey is that, as being a woman who in the past has enjoyed staying pretty fit and having cute hair and different haircuts and the latest fashion clothes and great shoes and all that kind of stuff, there's been a lot of changes for me, as I know there are for every cancer patient and every cancer survivor that traverses this, what I'm calling the valley of death. That's not about whether or not they die. It's simply the fact that this journey is such an intense one, and there are pieces of it that even in a blog it's hard to capture. But I wanted to speak to this tonight, because it's a piece that I've been struggling with. And even as a writer, especially one who's writing about living with cancer and living with a terminal cancer diagnosis, it's something that I have continued to struggle with even past some of the very poignant blog posts that I've done. But I wanted to bring it up because a lot of what you see in the media and a lot of what you see even on the news when it relates to somebody having with cancer, it's common to see somebody, without their hair, with their little do-rag on, which this is one of my most colorful ones. But we don't often talk about a lot of the other side effects and how that impacts the physical body. So I just want to give voice to those now, and not just for me, but for every patient, male or female, who's gone through this. So I normally would not prefer to do a video without makeup. I did do a little bit of lip gloss, but I just want you to see I am having some loss of the hairs finally on my eyebrows and even on my eyelashes, which sucks. Most of the other hair follicles, not only on my head, are not functioning elsewhere. So that's in a kind of a way good for me, except that I would prefer to have my hair here. It's still been hard for me not to have hair, and other than my wigs, which I delight in and I work with and so on, but it's still kind of abrasive to me when I go out into the community and have an experience when I'm even with one of these guys on, or one of my other things that shows that I clearly don't have hair, and people don't necessarily know that I happen to have cancer. It could be something else, but the energetic, and I think I've mentioned this before in another video, the energy that comes back is tough, especially from women. And continues to be. People avert their eyes, they take a glance, and then they look away because, again, they're dealing with their own fear or whatever their own experience has been with somebody being bald, especially possibly from cancer. But I want to just point out some of the other aspects that we don't talk about much. I'm going to shorten this. I just had a vitamin C IV today, and so here you can see the scar from where my port was put in, and my port, which was accessed earlier today for my IV. That goes... You can see this line all the way up here, and it goes down into my heart. That's actually pretty uncomfortable a lot of the time. And actually, I did have a blood clot that formed in my aorta, in my neck. And so as a result, I'm having to do something unfun like blood thinners. I had to do blood thinner shots for a while. Nobody talks about that stuff, but yuck, blah. But unfortunately, people who have ports, and not just cancer patients, often have to go through that kind of thing and stay on them for 6 months to a year, and often as long as they have the port. Nobody ever mentioned that before, except in some book that I got from the hospital that, I scanned through and didn't really give a lot of attention till I had to. What are some of the other aspects? I've had a runny nose for like 4 days of the past 5 days. Seems to be some kind of an allergic reaction from possibly the chemo, because I have not had a cold before, happily, knock on wood, in this whole experience. But I think generally, and then I'm not going to show you this, but I am going to talk about it because I just want to be open about it. I have had, in addition to hair loss and stuff like that, I have had, I think for many cancer patients that go through chemotherapy of any kind, your belly gets really bloated, which is uncomfortable. And that's not necessarily from one kind of chemo to another, but from almost every woman I've spoken to. I haven't spoken to a lot of guys. That seems to be a really common complaint and discomfort that happens. I've also had some bone pain and some nerve pain in my feet, bone pain in my hips. And again, these are things that can be treated and hopefully are not permanent, but that do happen and that make day-to-day life post-chemotherapy really uncomfortable. So I've had one of those days today where I've been pretty gripey, bitchy. And frankly, it's understood, given that I just don't feel like myself. And I think often for a lot of cancer patients too, especially going through chemo and or radiation, there's a lot of gray colored kind of skin. I do have a little bit of blush on up here and up there, but when you feel this crappy, a lot of the time you just don't feel as a woman like putting on makeup. I've tried, and you guys have seen me in different iterations, and I enjoy doing it when I feel like it, but there's a lot of time that simply I just don't feel like it. And I think given what I'm going through and given what many other cancer patients go through with chemotherapy and or surgery and or radiation, it's understood. I actually probably give myself a much harder time with my maneuvering of all this because I'm harder on myself. And I frankly miss the person that I used to be, the person I used to inhabit, my physical body that used to spring back, and it's weird. But it's very difficult as a cancer patient to have those kinds of feelings and emotions that emerge because your body is different. You're traversing all kinds of physical experiences that are not you and are from the cancer treatment, and you need to do them, but they're still really, really tough. So I wanted just to speak to that as much for my own getting over it because it's been in my head for a while. But I also feel like there are so many of us out here, and these are not things we're generally talking about, except on paper or maybe behind a closed door with your doctor. The reality is there's a lot of us out there, and I think for me anyway, it brings comfort knowing that I'm not alone, and I simply want to pass that along. So thanks for listening. For the cancer patients or those in your life that are going through cancer treatment, give them a hug. And one side piece I would say that I've learned very poignantly during this experience over the last months, especially losing my hair and walking around with these silly looking do-rags on and so forth, in the moments when I don't have wigs, is when you see those people, smile at them. Look back and smile. Ask them how they're doing. So many of us avoid because we don't want to embarrass or we don't know what to say or whatever, but the best thing you can do is remember that could be your sister, could be your mother, could be your dad, could be your brother, and treat them like that. Even if it's just a smile, it helps. So for more on living with cancer, you can see my Unbridled Woman, Unbridled Spirit blog, and that's at JuliAnneMurphy.com. Thank you.